People who are dying in hospice are not hungry and thirsty. This is going to be a video about how long can people on hospice survive without food and water. That is a common question I get all the time. How long can my loved ones survive if they're not eating and drinking? So we'll answer that in this video. And I'm going to tell you why people on hospice are not usually hungry and thirsty. Specifically, people often ask about why can't we feed them with a tube or start tube feeding? I'll answer those questions as well. The one saying I love to quote to all of my patients and families on hospice: your loved one is not dying because they're not eating and drinking. They are not eating and drinking because they're dying. Now, how do we know that? We know this because when someone is at the end of life, their body is going to show us. By starting the body to shut down, our bodies actually have built-in mechanisms to help us stop eating and drinking, because the body knows, hey, I'm starting to shut down here. Things are not working as they should be, and I'm going to start slowing things down so that the digestive tract slows down, the bowel movements slow down. We actually turn off mechanisms in our brain that make us hungry and thirsty. That is why 9.9 times out of 10 people on hospice or who are at the end of their life are not thirsty, are not hungry. Now, the families who are watching this and their loved ones who are watching this understand that they're like, hey, this doesn't sound right. This doesn't feel right. We need to do something about this. We need to start giving them protein shakes. They won't eat. So let's do this. Let's do this. Maybe we should try tube feeds. Maybe we should try a medication that makes them have an appetite. They want to fix the problem. That can actually cause more problems. One. So it's good to educate about this isn't a problem. This is something normal and to be expected. There are specific problems that actually are caused by people who are well-meaning, who try to force their loved ones to eat. And that is aspiration pneumonia, which just means that they are getting little particles of food in their lungs because they are usually not swallowing correctly, or because they're being force-fed. Their body is already not wanting the food, so they end up aspirating even just little particles that you can't even tell they're aspirating sometimes. Those particles settle in the lungs and can cause pneumonia. This is one of the main things we see in people with Parkinson's disease or any form of dementia. Another option people often want or think we should do is place a feeding tube. A feeding tube is a tube that goes into the stomach, basically surpasses the mouth and the esophagus and just goes right to the stomach, and they're fed through their stomach. And they think, well, if they don't want to eat, at least we can make them get nutrition through their stomach. This can work sometimes, specifically if you're not at the end of life. If you're not at the end of life and you're just having an acute issue where you can't eat for some reason and the rest of your body is not shutting down, tube feeds, I'm all for it. But when you're at the end of your life and you do this, there's usually just more complications because, like I said, the body knows it's shutting down. So the body is not processing the food like it should. Even if it's liquid, it's not absorbing the food like it should. And a lot of patients end up regurgitating some of the tube feeds, again, aspiration pneumonia, or getting an infection because this tube is placed in their stomach. So how do you know, right? How do you know if you already have a tube, right? Let's say someone had a stroke and they already have a feeding tube, and now they're getting towards the end of their life. They're still having the tube feed. That's the only way they get medication, how they get food. How do you know? People feel like that sounds archaic. How can we do that to somebody? We usually don't. First off, people on hospice can have tube feeds, and sometimes it's necessary. However, what we check is to see how well they're tolerating it. It's something called residuals. We check residuals. So let's say we give X amount of tube feed every 4 hours. Before we give the next round of tube feeds, we'll have the loved one check for residuals, which means they pull back on the tube and see if a bunch of tube feed is still coming out. If that is the case, that's showing us, hey, this person isn't really tolerating that tube feed because it's still there. After 4 hours, it's still in their stomach. So that can show that this person is not really tolerating it. Maybe we should cut back on some of the tube feed. Maybe not fully. Let's cut back, try that, and see where we're at. So there's always options. We can cut back on the tube feed, see how the person tolerates that. Sometimes they just aren't tolerating it, and it is better, risk versus benefit, better to stop the tube feed. The number one thing I get when I say something like that is, so we're just gonna starve them to death? That is not what's happening here. This person is dying. Whether they get food, whether they get nutrition, whether they get fluids, it doesn't matter. And a lot of times when we try to force those things because we think they're suffering because they don't have those things, it actually causes more suffering because the body can't process fluids. The body can't process tube feeds. The body can't do it. So we're actually causing more suffering by trying to get them to. That body does not feel hungry and thirsty. And we know that because most of the time when you're trying to make someone eat, they're telling you no, they don't want to. So by allowing the natural processes to take over, their life is usually more peaceful and their death is usually more peaceful because we're allowing the body to be the guide. We're allowing those natural processes in the body that help us die take over. So with that said, how long can someone actually live without food and water? Now that we know that your loved one who is already dying on hospice isn't eating and drinking, and we know that they're okay, we know that the body naturally does this to help us die peacefully, how long can they live like that? And our answer in a general way, as always, of course, is usually 7 to 10 days. Once they're truly not eating and drinking, usually within 7 to 10 days, they will die. However, some people surprise us. Sometimes it's shorter. Sometimes it's longer. And when it's longer is when the family really can start having a hard time because it's kind of like, how long can they do this for? How long can they do this? This is hard to watch. And I get it. And I always just encourage families, keep talking to each other, keep supporting each other, keep telling yourself, is my loved one clean? Is my loved one safe? Is my loved one comfortable? And if you can say yes to all those things, you just let their body process how it needs to process. And some people will linger for whatever reason. I think the longest I've seen someone do this is about 3 weeks, like 21 days. That's abnormal, but this person was comfortable and clean and surrounded by family, and we just, let their body be the guide. And again, as far as like a timeline, right? Especially in the elderly people with like dementia or some kind of cognitive disease where they'll only drink sips of water and maybe like a cup of yogurt a day. And families will be like, how long can they keep doing this? How long can they survive like this? And the answer is usually a long time. Even if someone's eating and drinking just a little bit, if their body is not ready to go, it's not going to go. So in those circumstances, again, it's hard to watch your loved one live like that, right? They're sleeping 22 hours a day. And then the 2 hours they're up is to be changed, and they eat a little bit, and they drink a little bit, and they go back to bed. And you're thinking, how can they keep doing this? And the answer is we don't really know, right? We don't really know how long they can keep doing it. But as long as they are clean, safe, and comfortable, you just keep showing up. And if you need help, ask, because it can be overwhelming and hard. Even if people are eating just a little tiny bit and drinking a little tiny bit, they still can live quite some time. We live in a culture where like food equals love. Feeding someone is how we love them. So it's hard for people to like wrap their head around the fact that like they're not doing that for their loved one. What's important here is to listen to your healthcare team, remembering that love is knowing that your loved one's body knows what to do. And as long as they are clean, safe, and comfortable, showing up is the love. Showing up and supporting your loved one is how you show your love.